All, this is Dr. Mubin Sayed from Dr.Been.com. Welcome to the Dr. Been Talks. Today we'll continue our discussions about COVID-19, and one of the drug that we had talked about was leronlimab. We have done those discussions about leronlimab separately. Then we had spoken with our guest here, Dr. Pourhassan, in the past as well. And there are some exciting things that are happening in this area, and I was receiving a lots of comments about leronlimab and further discussions. So I thought we would request for a follow-up as well. So Dr. Pourhassan joins us once more. Thank you very much, Doctor, for joining us.
My pleasure to be here, Dr. Mubin.
Thank you very much. We have a tons of questions from the cool beans here who are interested in understanding more. For the completion of for this segment, I know that we had done this discussion in the past as well about the background of Cytodyn and the leronlimab. But just for the completion of this video segment, if I can request you once more, if you can talk about Cytodyn, your background, what is leronlimab, so that we can then launch from there.
Yeah, sure. So my background is in mechanical engineering, but when I was asked to join Cytodyn, I had a 25-year background in business, so I was able to come into Cytodyn and take the company out of the bankruptcy. After a few years, we saw that the FDA put a hold on that molecule, which was called Cytodyn. That's when I was fortunate enough to come across Dr. Paul Madden's molecule, which is leronlimab. At that time was called Pro 140. We took it, and Dr. Paul Madden practically babysitted me and taught me everything I needed to know to go forward and be able to develop this product for a different path, which was practically my vision. But Dr. Paul Madden said, this is the path you want to take, that's fine, but this is how you should do. And I brought the team that Dr. Paul Madden had for Pro 140, Dr. Nitya Ray, manufacturing expert, Dr. Tom Boyd, and then the Amarex, Dr. Kush Dori, who's under Dr. Kazempour. So the team came together very well. I was very pleased with that, and we are where we are right now.
Excellent. Thank you very much. And for the viewers as well, and for Dr. Pourhassan as well, when you see my eyes just sifting around here, I am looking at the questions and I'm looking at the comments as well, and making sure that the viewers have their participation in here as well. So first of all, in the comments, I'm seeing lots of folks saying thank you for coming back for the discussions.
Sure.
Thank you. Now, questions.
Thank you for having me. Yeah, I'm sorry. Go ahead.
So these are the questions that I have already curated. And then I'm going to go over the questions here in the commentary as well and go over them. So some questions here about the data and blinding. So I'm going to start with that. So as someone not in medicine or research, I'm very curious on steps of statistical analysis that's done with the unblinded data. It is one. A similar question here is the data statistically significant positive news? Has the FDA received any of the results at this point? When will we know who received placebo versus not? When can you publish and release that data? So lots of good questions.
Very good questions. First of all, for everybody to know, to have a background that's not in biotech, it's not any problems, because you have to do a drug development. If you don't have the science background, like I don't, you need to have the top scientists to come and find a molecule. They call it discovery. The discovery for leronlimab was done 25 years ago, almost.
Oh, wow.
So that discovery was done by Dr. Paul Madden through Dr. William Olson, PhD from MIT, who worked for Dr. Paul Madden. Dr. Paul Madden did a fantastic job getting that product together. Now, when it comes to phase 1, phase 2, phase 3, if all those go well with FDA, then you get to announce your primary endpoint. When you hit your primary endpoint, FDA will look at that and say if you can file BLA or NDA, new drug application or biologic license application. Once that's done, the FDA will have to give you a PDUFA date. And the PDUFA date will set the time for how long time FDA has to review all that application. If your application is not as extensive as they want it to be, then they could say, okay, refuse to file, which we got, and then come and cure these things and perhaps come and talk to us in a type A meeting to make sure this time we have everything settled down the right way, and then file the BLA again. and that would delay it sometime a month or two. Once you do that, then you get a PDUFA date and you go forward. Now, in regards to COVID-19, everybody is very focused on this, and we said we will be unblinding the data by last week, which I told everybody we are unblinding it. So during this weekend, I don't have the data. I don't have the unblinded data. During the weekend, Amarex is working very hard to have those results, and I'm hoping to be able to get results on Monday and have a press release on Tuesday. Is it statistically significant? Well, that's what we want to find out. We had 75 patients. There was 86 patients enrolled. There is two different type of analysis. One is ITT, is intent to treat, just everybody that's there. One is according to the statistical analysis plan, SAP, that we have already submitted to FDA. There might be some patients not being able to count toward the analysis because of some reason they didn't meet the going forward criteria. With all of that said, usually people will take 6 to 8 weeks after locking the data before they can announce something. This is not the case now because we're in pandemic and we're going forward as fast as we can. So I have a lot of enthusiasm about the data from day one. Why? Because as some people said, anecdotal, don't just walk out of ECMO. And that was a quote, I believe, from Dr. Bruce Patterson. If that's happening, if we have those kind of results where 60 emergency IND in a very critical population, then moreover, how does this going to come out? So the results, as soon as we get that, we are able to announce whatever we can. There might be, we just have to wait till a few more days to get those results. We're anxious, but very, very optimistic about it.
Excellent. Thank you very much. Thank you. So I'm going to look at my next question here. If the mild, so this has been a question that is very frequently asked, and it has two parts. One question is that if the mild to moderate trial is a success, what is your next step in two ways? Number one, how would you set up the supply chain? How would you distribute it? Would this be available for outpatient? Would this be available in pharmacies? Would this be available for at-home use? Number one. And the second part is, how are you envisioning to push further? Do we go into the severe trial? What is your thought there?
So